Hello, and welcome to week 7 of this educational series. This week, we're just going to scratch the surface on pediatric feeding. If you have not tuned into the previous sessions, we have already covered postpartum physical health and mental health, NICU care, attachment, development, and sensory processing. All of the resources from our previous sessions are on our website, which I will have linked at the end of this slideshow. If you don't know me, my name is Grace, and I'm a third-year occupational therapy student. This series is being provided as part of my capstone project. I am a mom to a 1-year-old, and occupational therapy focuses on occupations. These are the things that we want or need to do in a day that are meaningful to us. So some of my favorite occupations are playing with my daughter, going on walks during sunset, and binge watching TV shows with my husband. If you're tuning in on our YouTube channel, I would greatly appreciate it if you were willing to fill out this survey. It is brief and anonymous, and it just aims to demonstrate effectiveness of the session. These are the topics that we will go over today, so let's just jump right in. Our first topic that we're going to discuss is breastfeeding. We're going to go over just some of the basics, but during week 1 and week 3 of this series, I discussed more in depth about breastfeeding, including breastfeeding positions, latching, hunger versus stress cues, and more. So if you want to learn more about that, you can find that material on our website. Again, I'll have that linked at the end of the slideshow. And you can find a little bit of information in the postpartum physical health, but it's mainly going to be in the NICU section, which just because it's NICU doesn't mean it doesn't apply for you. So, with breastfeeding, the AAP, or the American Academy of Pediatrics, recommends that women exclusively breastfeed their children for the first 6 months of their life. Breastfeeding helps build up a child's immune system, and it can help promote mother's immune system and other health factors for a mom. When beginning your breastfeeding journey, newborns will typically begin to feed every 2 to 3 hours, equivalent to about 8 times per day. Some infants will want to feed more frequently and some less frequently. Your doctor can help guide you on what's the appropriate feeding time and amount that your baby should be getting, depending on their weight and their health. Newborns generally will eat around 1 to 2 ounces per feed, but this will quickly increase to 2 to 3 ounces by 2 weeks old, and then it'll continue to increase about after that. Every woman's breastfeeding journey is different, and different women can experience different hurdles. So, some common difficulties that often arise when breastfeeding include breast engorgement. So, this is when your breasts overfill with breast milk and become swollen and painful. You also may experience oversupply or undersupply of milk, clogged milk ducts, mastitis. So, mastitis is inflammation that is often due to an infection, and this can occur when you have a clogged milk duct. And it is generally accompanied by red and warm spots on the breasts, fever, body aches, fatigue. And if you think you have mastitis, you want to contact your doctor. They can prescribe medication to help fight the infection. While breastfeeding, you also may experience sore, cracked, or painful nipples. I just want to add in here, breastfeeding itself should not be extensively painful beyond that first 30 seconds of a latch. Of course, if your nipples are cracked and bleeding, that's going to impact that. But if you're having significant pain or difficulty with latching, I would definitely recommend that you see a lactation consultant. They can help kind of guide you through next steps. While breastfeeding, you may also experience difficulty due to anatomical differences, so things like flat or inverted nipples. You may also experience difficulty with weaning, so a little bit more down the road in breastfeeding. All of these challenges can make breastfeeding feel even more challenging than it already feels, and it can impact your health as a mother. So if you're experiencing any of these, contact your doctor. And like I said, we did already cover those things like positioning, latching, hunger and stress cues in previous lectures. So if you want to learn more, the website is here. It's in bold. You can plug that right into your web browser. And there's a little bit of information in the postpartum physical health, but the majority is going to be in that NICU content. You may also choose to bottle feed your baby. So, if you choose to go this route with your baby, some basic equipment that you can find helpful are multiple bottles with different nipple flows. So, every baby's different in what they like. You might have to do some experimentation on which bottle type your baby likes. Some babies love Dr. Brown's, some love the Phillips Advent. So, you really just kind of got to work around and figure out what it is your baby likes. But regardless of the brand, you will want multiple nipples of different sizes, ranging from that 0 to the 4 or the Y cut. So some people even need that preemie size as well. With those nipple flows, a level 1 is meant for 0 to 3 month olds, and it's considered the slow flow nipple. Level 2 is for 3 to 6 month olds and is a medium flow. Level 3 is for 6 month olds and older, and it's a fast flow. And then that level 4 or the Y cut is for 9 month olds and older, and it's considered the extra fast. You can use this kind of as a guide for when you might want to switch to the next size up for which nipple to use with your baby. But every baby is different and has a different tolerance. So you know your baby best, and you should do what's best for your baby. So if your baby hits 6 months old, maybe they're sticking with that level 2 until they're 8 months old because that's what they need. And that's okay. Some other equipment that is helpful if you're going to bottle feed is a bottle brush. These typically have attachments that allow you to brush up into the nipple part to make sure it's nice and clean. A drying rack, and of course the breast milk or formula. And then many people also choose to get a bottle sterilizer. Um, it's nice to have, but there are other ways you can sterilize bottles as well. You don't necessarily need to have the bottle sterilizer. You can use a pot of water or even the microwave, but I just want to suggest that if you're going to go this route, that you find a good source to guide you on how to sterilize bottles in this manner so that you do not accidentally melt any of the bottles. It is recommended that you wash your hands well before you make your baby's bottle and ensure that you're using sterilized bottles for each feed. Before feeding the baby, make sure the lid is on really tight and test the temperature of the milk on the palm side of your wrist. This part of your wrist is more sensitive to temperature changes and can be used to know if milk is too warm or even too cold. The milk should not burn or feel hot on your wrist. You want like a lukewarm kind of temperature. In terms of positioning and pacing during bottle feeding, generally we recommend a left side lying position. So, laying baby on their left side with their head elevated above their hips, so kind of tipped up. This position helps prevent reflux due to the shape of the stomach, and it can just be helpful when pace feeding as well. You want to use an age appropriate nipple to ensure a proper paced flow. And if you need to pace the bottle feed more, you can gently tip the bottle backwards so the milk is moving away from the nipple while baby is still latched. Or if this doesn't work for your baby and it's more beneficial to take the bottle out altogether to allow baby to catch back up and re-coordinate that suck, swallow, breathe, you can do that as well. This process, the taking the bottle out of the mouth, can be difficult for some newborns because that process of having to relatch is hard. Be sure to give your baby plenty of opportunities to sit up and burp. And if your baby really struggles with reflux, have your baby remain upright for 20 to 30 minutes after a feed. If you plan to pump to feed your baby, whether that's bottle feeding or you're breastfeeding and pumping, there are a couple different approaches that you can take. So, some women choose to pump one breast while feeding their baby on the other. This can be helpful because it catches that extra letdown on the breast that baby's not currently feeding on. Um, some women, if you're returning to work or school, will pump there. And so you want to ensure you're staying on the same pumping schedule that you use with your baby at home. So that might be that 2 to 3 hours. It might be longer, might be shorter. This is just going to help prevent breast engorgement and hopefully reduce pain for you. When choosing to pump, you want to choose the appropriate flange size for your nipple. So, this can help improve milk flow and significantly reduce pain. There is a picture here at the bottom to kind of help guide you on what might be the best fit. Really, ideally, what you want is just that nipple to be inside that like elongated part of the flange. So, if that is not happening, if you're getting some of the areola in there as well, it might be a not very great fit, or if the whole nipple is not coming through. So, this is an area where a lactation consultant can help you determine what's the best fit and they can measure you. You also want to choose a pump that fits your needs. So if you're going back to work and you don't have super great access to outlets when you need to pump, it might be best you have a hands-free pump that you can charge at home. Or maybe you're staying home and you're going to pump sitting next to the wall plugged in. Well, then great, you can have one that plugs into the wall. You just want to kind of choose what's best for you. When pumping, you can start out by hand expressing. So that's essentially just taking your hand on your breast and squeezing some of that milk out. This is going to help promote that milk flow before you start the pump. You want to make sure you're drinking lots of water and eating good snacks. And it's actually recommended that you look at pictures or videos of your baby if you're pumping while you're not around your baby, because this helps promote the production of hormones that are needed in order to produce and allow the letdown of milk. The CDC outlines safe storage and milk use. So, for freshly pumped breast milk, you should use it within 4 hours of pumping it if it's left on the counter. If it's put in the fridge, you should use it within 4 days. And if in the deep freezer, it can be good for around 6 to 12 months. 6 months is kind of the better bet. The closer you get to that 12-month mark is when the nutrients in the milk really start to decrease. If you choose to thaw out previously frozen breast milk, it should be used within 1 to 2 hours if it's thawed on the counter, used within 1 day if thawed in the fridge, and it should never be put back into the freezer. If you make baby a bottle, whether that's breast milk or formula, and they decide not to finish it, it should be finished within 2 hours, or else it should be thrown away. To store pumped breast milk, you want to ensure that you mark it with the date that it was expressed. Many mothers will also mark whether it was pumped during the day or at night. This is because at nighttime, that milk has an increase in hormones like melatonin that help promote sleep. And so a lot of moms will give the nighttime milk in a bottle at night because that melatonin is already really high. When putting milk into the bag, you want to make sure you don't fill it all the way to the top because the milk is going to expand when you freeze it. So you want to leave some room. A lot of bags kind of have like a mark or a tick on how full it should be. And then you want to get out as much air as you can so that you can lay the milk flat to freeze. This is going to help it thaw a little bit easier. And you want to avoid storing frozen breast milk in the door of the freezer because as it's opened and closed, it can significantly change the temperature and it could make the milk thaw and then refreeze, which is, like I said, is what we want to avoid. So, like I said when I talked about breastfeeding, it is recommended that a baby is exclusively fed either breast milk or formula for the first 6 months of life. Around that 6 month mark, you will likely want to introduce purees, although some infants will be ready for this transition around 4 months instead. Some signs that your baby might be ready to start this transition include being able to control their head and neck on their own, so they're not all floppy with their head and neck. They can sit unsupported in their high chair. They open their mouth when they see food. They bring objects to their mouth. and their tongue thrust is gone. So, that tongue thrust is when you put food in their mouth, they will swallow the food instead of using their tongue to continuously push it back out of their mouth. Some parents may decide to introduce purees first, but then transition into solids. So, when beginning solids, there's really no general recommendation for what order you should progress with. You just want to be sure that you're offering a variety of foods like infant cereals, proteins, fruits, and veggies. It is generally recommended, though, that you introduce one single food ingredient at a time and then wait 3 to 5 days before you introduce another. This is going to allow you to determine if your child might have any allergic reactions to the foods that you're giving, and then you don't have to question, was it this food or was it this food? Some common allergens that you want to introduce early include eggs, fish or shellfish, tree nuts and peanuts, wheat, and soy. You also want to introduce cow's milk, but it's not recommended that you provide straight cow's milk to drink until a child's around 1 years old. So instead, try to introduce things like yogurt, cheese, and other cow's milk products. It's also important to note that babies, this is not on the slide, but can not have honey until they're 1 years old. A lot of people I feel like don't know that, so just something important. Some signs of an allergic reaction in children includes hives or rashes, facial swelling, so like their lips or their eyes might swell, vomiting, diarrhea, breathing issues, so wheezing or noisy breathing, pale skin, and then sudden behavior changes. If they become really, really, really fussy, that could be an indicator that they might be allergic to something. Some parents may choose to skip the purees altogether, and this is typically a process called baby led weaning. So, this entails going from breast milk or formula into a diet that includes solid foods. When doing baby led weaning, you want to cut the food at an age appropriate level that allows your child to grasp it. So, around that 6 months, you can see in the picture here, that's when they're going to be using their full palm to grasp rather than their fingertips. So, cutting things into larger strips to allow them to grasp with their full palm is helpful. This also allows them to chew and suck on these foods without getting small chunks that could cause choking. At around that 8 month mark, that's when they're what we call the pincer grasp. So picking up things between their index and their thumb is going to start to really play in. And so this is when you can kind of start to cut food into those smaller little cube shapes instead. You want to allow your child to feed themselves with this approach. So, if you need to, you can provide like a small infant safe spoon. They're not going to get it quite yet, they're not going to know how to use it super efficiently. So, you can demonstrate and help them as needed. And then finally, try your best to eat together as a family and don't put pressure on your child to try or eat certain foods. Just kind of let them explore as they see fit. When trying the baby led weaning approach, and even sometimes with purees, gagging is very common as a baby begins to discover new textures and learn about how much food to put in their mouth. You want to ensure you're supervising your child while eating, as choking can occur. You should be aware and prepared to properly intervene if your child starts choking. So, I definitely recommend taking like a pretty basic like CPR class, first aid class. They can teach you what to do if your baby's choking. And then here I just included a chart about the difference between gagging and choking. So, a lot of times with gagging, their face is going to turn red and their eyes might start to water. You'll probably hear them cough or make like weird little noises. And a lot of times, then they start screaming. I've always heard that screaming is a good sign because that means their airway is open and so they're not choking. Choking is when that airway is blocked and instead their face or lips might turn blue or purple because they're not getting oxygen in. And instead of making sounds, a lot of times they're quiet or silent because they can't get anything out. Some babies also experience tube feeding. So, some types of tube feeding that is common among children include an NG tube. So, this is placed without surgery and is put through the nose and straight into the stomach. An ND or NJ tube is also placed without surgery and it goes through the nose to end in the small intestine. A G tube requires surgery to be placed. It's put directly into the abdomen to end in the stomach. And a J tube also requires surgery for placement, and it's also put directly into the abdomen to where it ends in the midsection of the small intestine. So, I want to just preface that your doctor will help determine when your child is safe to begin eating solids if your baby is tube feeding. It's not always safe for babies to ingest food by mouth if babies are tube feeding due to risks of aspiration or any other medical complications. So, if your child is not yet safe to ingest food by mouth, it is still very important that you're providing opportunities for them to work on sensory exploration and oral motor skills. So you can do this by providing non nutritive sucking, so that it can be done through the use of a pacifier or teething toys. And then once your doctor approves, you can begin solids, and an OT, SLP, or feeding therapist can really help guide you into how to introduce new foods and build a positive feeding experience. You really want to try to avoid forcing them to eat or try something on their plate with children who are really just learning about new foods. You'll want to offer a pretty good variety and always try to include at least one food that they already like. This is going to help them gain the confidence to interact with those new foods if there's something there they know they like. Let them explore, get messy. This is really important for building those positive relationships with food and helps build sensory experiences. And then, like I've said before, if possible, eat together as a family when you can. Stick to your household routines as much as you're able. Avoid screen time during meals to allow your child to pay full attention at the table. And especially with your baby tube feeding, work together with your healthcare team to ensure safe feeding that promotes appropriate nutrition while also increasing food exposure. I really, really want to emphasize the importance of positive feeding experiences. Quantity is important, yes, but so is quality. Being able to build a positive relationship with food is going to set a child up for how they eat and how they interact with food later on. Cue based feeding or infant led feeding is a type of feeding that follows your child's cues to promote feeding opportunities. So, your child will give you cues or hints that they're hungry or that they're full. And I covered these more extensively again in those NICU slides. So, you can definitely head over there if you want a little bit more information about this. But I did attach a couple pictures here at the bottom of what some hunger cues look like and some fullness cues. This is cue based feeding is typically the approach that's recommended to follow to help ensure quality, positive feeding experiences by following your baby's cues and letting them determine that internal drive to eat. So, I want to go over some feeding milestones that you can expect your child to go through. So, again, that 0 to 6 months, that primary form of nutrition is breast milk or formula. So, you'll see them either latch to the breast or bottle. At this stage, some infants might be tube feeding already, so might be a little bit different. At 6 to 9 months, your child will be doing the things necessary to begin an introduction to solids. So I talked about that on the last slide, the things like holding their head up, sitting up unsupported, all that. And they also will start to move those solids around their mouth in order for them to swallow it. So this is where they'll kind of start working on creating that what we call a bolus. So that's when a baby or anybody uses their tongue to move food into their essentially their cheek so that they can swallow it. At this stage, it's recommended that you start giving very small amounts of water. I emphasize small because too much water can actually be harmful at this age. From 9 to 12 months, a child will start using their fingers to grasp and manipulate foods. They'll start drinking from an open cup with assistance and a lot of spilling. And they may attempt to hold a spoon, but it'll probably be pretty messy. From 12 to 18 months, a child can drink from a straw without spilling. They will improve their ability to use a spoon, and this is generally when you start to want to introduce cow's milk, is around that 12-month age. From 18 to 24 months, a child will be able to chew and swallow food without spilling out of their mouth. They will be able to drink from an open cup with very little spilling, but probably still a little bit. And then from 2 to 3 years old, a child should be able to use a fork and a spoon, although they will still use their fingers frequently. And they will be starting to drink from an open cup without spilling. So, around that 12 to 18 month time, it is not uncommon for children to start to form more personal opinions about different foods. So, I think it's important to talk about picky eating versus problem feeding. So, a picky eater will eat at least 30 different foods, where a problem feeder is going to have a very restricted range, oftentimes less than 20 foods total. A picky eater, when food jagging, will accept it again, that food, after a 2 week break. So, if you don't know what food jagging is when a child essentially really likes a food and they eat it all the time. And then all of a sudden they have this, like, I don't want that, and they won't eat it anymore. And so, a picky eater, you give them a 2 week break, offer it again, they'll take it, no problem. A problem feeder, if they jag a food, more than likely that food is never going to come back ever again, even after taking a break. And this can significantly cause problems because their range is already so limited, like I said, under that 20 foods. And so, if they're constantly food jagging foods, they are restricting that food range even more. A picky eater is typically able to tolerate new foods on their plate, and they may even like touch or taste it, but they're going to do so pretty reluctantly. And then a problem feeder is going to cry, protest, and even fall apart when they're presented with new foods, and they will have nothing to do with the food. A picky eater will eat at least one food from most texture and nutrition groups. So, things like protein, fruits and veggies, grains, they'll be able to eat at least one from every group, where a problem feeder is more than likely going to refuse an entire category of food textures or nutrition groups. A picky eater will oftentimes eat a different meal than the rest of the family, but they are more than willing to sit at the table and eat with the family. Where a problem feeder, almost always they're going to have a different meal, but they oftentimes don't eat with their family either because they can't even tolerate those new foods being around them at the table that other people are eating. A picky eater is sometimes reported by a parent at their well checkups, but typically this is when it's been happening for less than 2 years. A problem feeder is indicated by parents are persistently reporting that their child's a quote picky eater across multiple different well checkups, and this has been going on for more than 2 years. One of the most common feeding approaches that really kind of dives into that picky eating versus problem feeding is called the sequential oral sensory approach, or the SOS approach. So, in this intervention approach, they aim to promote child led and play based feeding to help reduce stress around food. So, that's you don't have to eat anything. You don't have to try anything that you don't want to. But what we are going to do is we're going to play with it. So we take our veggie straws and we play hockey. And then can we take our veggie straw and blow a pom pom across the table? Okay, well, now we're progressing from just being able to hold that veggie straw to putting it in our mouth. So really just turning all of our food interactions into play. This approach also follows that hierarchy for gradual exposure, so kind of like what I just talked about, but essentially moving children from kind of those lower levels of won't even tolerate that food in their vicinity to can we at least tolerate it on our plate? Can we tolerate it on a napkin next to our plate? Can we start to interact and touch it? Can we not touch it, but just lean our head down and smell it? And so you want to really just work up this ladder, and this is where feeding therapists can come in and help kind of guide this. This approach also looks at the entire child, so it takes into account the physical, emotional, cognitive, and social well-being of a child. Um, this approach emphasizes those positive mealtime experiences and sticking with routines. Routines are really important, especially for like problem feeders, because routines allow them to know what to expect. And so their nervous system is less amped up if they're following those predictable routines. And so, one of the routines that we followed when I worked in the pediatric clinic was okay, we do some sensory input and then we go eat snack. And when you walk in to eat snack, you always go wash your hands and you sit down at the table and then you're ready for snack. We always had white plates, white cups. So it was the same thing every time with every kid. And then this approach is very common to be taken by occupational therapy to help address feeding difficulties. Just a few tips for feeding at home, whether your child's a picky eater, problem feeder, starting solids, any kind of feeding. Um, First is, like I said before, provide at least one food that your child likes at each meal. This is going to help them just start to feel more comfortable with those other foods on their plate. And while they might not interact with it, it does take a lot of exposure to get a child to want to interact with a new food. Having that safe food on their plate will give them the confidence to slowly work up to interacting with those new foods. You want to offer smaller portions of about 2 to 3 food options. If there's too much on a kid's plate, they can get overwhelmed. And this is not going to help build that positive sensory experience. So, like I said as well, you don't want to force your child to try or eat all of their food. You can decide what, where, and when food is served, but essentially, children decide how much they eat. So, you might decide that we're serving chicken nuggets, mac and cheese, and carrots. And your kid decides to only eat the mac and cheese, trying to force them, oh, try the chicken nuggets. I think you'll really like it. Or 2 more bites. While it is intended to be helpful for some kiddos, it can actually cause those negative experiences with foods, and they're not going to want to try those foods later on. If your child does reject a food, continue to offer those rejected foods. Don't be like, oh, well, I know they don't like it, so don't offer it. Continue to put it on their plate. It takes roughly around 10 to 12 exposures to a new food for a child to feel comfortable to want to interact and try that food. So continue offering those foods. Like I said as well, avoid screen time at the table and eat as a family. This is to help avoid some of that distraction that might impact our feeding skills. Engage in conversations that are not based solely around food. So if you're sitting at the table and all you're doing is talking about, wow, this chicken nugget is really crispy, or, it almost in a sense puts a pressure on the kid regarding the food in front of them, and that can make them more hesitant to want to try it. So try to talk about some other things at the table. And last but not least, do your best to try to make eating fun. I think that one's a little bit hard because you're kind of raised to, you don't play with your food. But if you have a picky eater or problem feeder, playing with your food is going to help them feel more comfortable to want to interact with that food. So find simple ways, like they make cute little food cutters, and can you cut through your chicken nugget with this butterfly food cutter, or fun little tongs that they can eat with. So just a few ways that you can kind of start to work on things at home. But above all, if you're really struggling with your child's feeding, I definitely recommend consulting an occupational therapist, speech therapist, or a feeding therapist. Like I said at the beginning, occupational therapists focus on what we call occupations, which are the things that we want or need to do in a day. And for all of us, eating and feeding is one of those things. And eating and feeding is a lot more difficult than it looks on the surface. So, OTs are able to assess feeding challenges and work to improve motor, sensory, environmental, and behavioral barriers to eating. OTs will work directly with parents to help with carryover of feeding skills within the home to help build positive feeding experiences. If you're not sure whether you're just kind of working through that, my kid, it's just kind of hitting that stage of picky eating, a lot of kids go through it, or if you need professional help, some indications that you might want to seek out feeding therapy services include your child has a significantly limited diet, so less than those 20 to 30 foods, so putting them more in that problem feeding versus picky eating. If your child's losing weight or having difficulty gaining weight, if your child is persistently gagging or vomiting during meals, if they're coughing or if they seem to have difficulty chewing and swallowing foods, if your child has sensory processing differences that might make food intake more difficult, and then any medical diagnoses that might impact a child's ability to appropriately progress through food as we would expect them to, or even kind of those fine motor skills we need to eat. If there's a reason that your child is having difficulty doing that due to a medical condition, occupational therapy can help with adaptive equipment and all kinds of things. There can be some blurry lines between SLPs and OTs in this feeding role. So, generally, what I found for SLPs is they focus on food management in the mouth and safely swallowing that food, where OTs will typically focus on the sensory and functional eating aspects. So, like I said, those fine motor aspects. Um, but there still can be some blurry lines between these two. So, your doctor can help you determine what might be best for you. And sometimes it comes down to the availability of what's available in your area. This is the associated handout with this session. So, on the second page here, you have the community resources. So, that's a list of resources in the Cheyenne community. That middle one will take you right to our website, and the one on the right is for my references that I used to make this slideshow. This will be available on our website as well. If you took that pre-survey, I would greatly appreciate it if you also take time to take the post-survey so I can see just how effective that session was from pre to post. Again, it's brief and anonymous. So this blue link here is our website, and if you scan this QR code, this will also take you to that list of Cheyenne resources. And then just a couple kind of honorable mentions that I wanted to include in this series here that can be helpful are these podcasts. So these are led by a couple of feeding therapists, and they talk about everything that we discussed today in so much more detail, and they talk about so much more than I was able to talk about today. So I've listened to them on Spotify, but I highly recommend them. Next week, we're going to discuss behavioral regulation, so tune in for that. And this QR code is my list of references. Thank you so much for tuning in, and I hope you'll tune in next week.